Hello, my name is Tara McAllister, and this is my oral presentation for Business 153. I was given the topic of the Health Insurance Portability and Accountability Act, which is also known as HIPAA. HIPAA is a law that was put into place back in 1996, and there's actually several different things that it covers. One being the privacy of the patients, and two, it also helps with insurance coverage while changing positions from job to job or while changing marital status. One thing in regards to the insurance coverage being that it can exclude you for pre-existing conditions, meaning that if you knew that you had diabetes prior to insurance coverage, then it couldn't exclude you or discriminate against you by not providing health insurance because of that. You would still be able to have insurance regardless. Another thing that it helps with or that it protects against is going to be the patient's privacy. And what that means is medical information pertaining to you specifically could not be given out. No information in regards to you or in regards to your health can be given out. It can even, any identifiable information such as social security numbers, birth dates, medical discharge dates, anything of that nature cannot be given out to anyone in regards to you unless you specifically sign a note in regards to that person being able to receive that information. No information can be given about your medical care or medical treatment in regards over the phone. And if you've ever noticed that once you go to a hospital or a medical practice that there's a partition separating the receptionist from the patient being seen. Reason being that because once the glass is closed, the receptionist can speak with the nurse or whomever's behind the desk with her in regards to the patient's information, but the people in the waiting room or in the hall or wherever wouldn't be able to hear that information. That's the reason for the partition, to separate the patients from the receptionist so the information can't be given out. If you are concerned about HIPAA violations, there are laws in place that are for that as well. You would need to contact your Health and Human Resources Manager in regards to that if you feel that it has been violated. If you're working at a hospital and you're an employee there, you have certain protocol that you follow to prevent HIPAA violations from happening as well. Like if you're two nurses walking down the hall, you wouldn't be discussing another patient's information as well because someone passing by could also hear that information. So they have to be mindful of that as well while working. And not just nurses, but I mean if you're in the hospital in general, whether you're the cafeteria worker, the engineer, or whomever, you still have to be mindful of patients' rights and patients' information. Patients have rights in regards to their information being kept private. They have the right to complain. They have the right to ask for their information to be published and given to them. They also have the right to have their information changed if they feel that something had been omitted or was input improperly into their files or records. So that would be one thing that you would need to keep an eye on if you're a patient. If you're consistently going to a doctor, you would want to keep up with that information, because if for some reason you become unemployed or what have you, or change positions within your company, or for whatever reason you're divorced now and you wasn't 6 months prior, you can't be denied medical insurance because of that space and gap or because of the status change. You would have to have the medical documentation to state that you've had the coverage, and as long as you have that medical coverage information, then they can't deny you the existing or pre-existing medical conditions in regards to your medical insurance. So that's something to think about as well. In regards to why this would be pertaining to the human resources field or human resources class, is because the Health and Human Resources Department is the ones that you would contact if you feel like your HIPAA violation or your HIPAA policy has been violated. That's who you would contact. You would also contact the chief officer over your insurance if you feel like you have been discriminated against in regards to health insurance coverage. HIPAA also takes place in regards to not just the medical field, in regards to patient care in the hospital environment, but also with mental health. That's also covered on there as well. And just say for an example, you're a skydiver or you like riding horses. you can't be denied insurance in regards to the HIPAA because of those acts as well. They can deny to say that this injury was caused because of that incident, because of a horseback injury, or because of a skydiving injury. They can deny the coverage to pay that, but they can't deny you insurance coverage as a whole because of that. So that would be the information that I have in regards to HIPAA and the HIPAA violations, also known as the Health Insurance Portability and Accountability Act, established 1996. Thank you and have a great day.